Well, more now on the coronavirus pandemic and how technology is helping clinicians. With me now is Alan Lowe, CEO and co-founder of Visionable, which specialises in medical video technology. Welcome to you. Alan, first of all, tell me how technology is implemented in the NHS, how it actually helps.
OK, so at Visionable, we exist to sort of provide tools for the clinicians. So rather than saying this is what you use it for, it's more a case of here is some capability and what would you like to do as a clinician. So to give you some examples, what we do is we have a stroke project in the east of England where there's not enough stroke doctors in the NHS. So depending when you have the episode, you're taken to the nearest A&E, but there might not be a doctor there. So what we do is we bring in remote clinicians from home who can, almost like air traffic control, they can monitor the hospitals, bringing them what they need, when they need. So we've treated over 4,000 patients that have had a stroke in the NHS. We also do things like where we bring clinicians together to discuss cancer treatments. So we do that all across London. So when a patient has cancer, rather than have one expert, you bring that collective expertise, look at the scans, look at the blood results, and make the best decision for the patient.
So pooling resources by technology. And the example that you gave of stroke patients, would that be a monitor that would be brought to the bedside and that would be the clinician that's not actually in the room?
Yeah, so exactly. So at the moment, it's a medical cart with a camera. But moving forward, we're doing some pilots now with lapel mobile phones, where the nurse or the doctor can just have eyes on a patient and then they have a piece in their ear, so they can bring the expertise in without the outlay of a medical cart each time. And that allows it to scale for lots of different use cases like ward rounds and so on.
With the coronavirus crisis, the medical profession is saying that now they are actually going to have to rely on technology, and people visiting the GP is something that we don't need because that's extra pressure on the service. Is that an area where your services could be deployed? So, for instance, people could have a consultation with a GP without actually going into the surgery? Absolutely.
So this isn't something new. This has been happening. It's now being accelerated. So outpatient clinics, GP appointments, we provide that exact tool. So if a patient out there wants to get a text message, hit a link and talk to a doctor, that's now available. So it's more a case of what the NHS are doing now to provide those services. And we are there to sort of help them with the trust and reliability to enable that.
Well, why do you think it hasn't been rolled out before? Because it sounds like it will save a lot of resources and a lot of time and actually money.
Yeah, I think one of the challenges with the NHS is change, right? So things have to change, but you've got a system that does not stop. You know, patients are coming in every day. So to make a fundamental change from a physical way of working to a digital, it takes time. So I think it's a combination of people working together, and I think you're going to see now people really working together for the good of the patients, because that's what the NHS does well.
Have you been approached by government at all to tap into your services at this crucial time of need?
Yeah, more through the NHS ecosystem. So we work with most of the hospitals. We work with NHS England, NHS Digital. So yeah, we are working with the government agencies to deploy this.
Tell me about the smart ambulance. This is something that you've...
Yeah, so we've been working on a smart ambulance. It's part of a 5G world that's coming, but we're also doing it now over 4G and 3G. So the idea is the paramedic is in the ambulance and they can bring in expertise. So if a patient's having a stroke or a heart attack, you can bring in the specialist that deals with that scenario. What that means is you can get real-time expertise in a life where time is important, but also you might not need to take that patient to hospital, you know, taking up a valuable bed. So we're working with O2 and Verizon in the US to develop these connected ambulances. But the idea is to become mobile hospitals.
How much pressure do you think digitalisation can relieve the NHS? How much pressure can be taken off the system? Because we're told that at this particular time, the resources need to be saved.
Yeah, absolutely. So one of the things that digital technology can do, you can run services 24/7. You don't have to have doctors travelling to and from locations, and you can pull on a global workforce. You could have people in different time zones coming in and providing healthcare. So, but also for the convenience for the patients. Patients are scared, they're anxious. Being able to see a face is really going to reassure people.
Just finally, there are some instances, though, that you know, digital technology will not be able to replace an actual consultant. I mean, you accept that? There are, 100%, for instance, even with 100%. Testing.
Absolutely, absolutely. You know, there's nothing better than having the expert with you, you know, holding your hand, whatever it needs to be. But in a situation where there's not enough doctors, this is an option.
OK, Alan, thank you very much for sharing your expertise with us. Thank you.